Hello, I'm Dr. Geoffrey, a board certified emergency medicine physician and a decisions expert, as well as a crisis management expert. I want to talk to you just real quick about COVID-19 as it relates to colon cancer. COVID-19 as it relates to colon cancer. And even for those of you all who are not of age to be concerned about colon cancer, please share this with your loved ones. Let me connect dots just real quick. Um, uh, Colon cancer, about 90% of colon cancers are 100% curable if caught early enough. The main way you catch colon cancer is via a colonoscopy. The recommended age is 45 on up, and then every 5 years thereafter. Here's the thing about, there are 4 stages of colon cancer. This is not going to get real technical. Just basically in stage 1 and 2, you're asymptomatic. You're asymptomatic. You don't even have any symptoms. You don't even know that you have colon cancer. But then in stage 3 is when you, by the way, in stage 1 and 2, if caught, which would be caught by screening colonoscopy, it's 90% curable. Stage 3, you're symptomatic, and at that point, you're about 50-50. It's 50% curable and 50% death rate. Stage 4, the ability to cure is even worse. What is my point? Is that in order for it to be 90% curable, you must catch it at stage 1 and 2. And how do you do that? From a screening colonoscopy. You say, hey, Dr. Geoffrey, wait a minute now. This talk is supposed to be about COVID-19 and increasing colon cancer. Follow me. And by the way, a lot of my information comes from a world-renowned gastroenterologist, Dr. Kester Cross. You can go to his Facebook site. He does a wonderful talk on it. But follow me. As a result of COVID-19, there's been a decrease in screening colonoscopies for a number of reasons, meaning people not going to get their colonoscopies. Many GI offices were closed. As a result of decreased screening, there will be an increase in colon cancers later if we don't get caught back up. Again, if you're screened and you're caught, and the screening catches in stages 1 and 2, which is 90% curable. Stages 1 and 2 are 90% curable. That's why a screening colonoscopy is absolutely essential. Absolutely essential. And let's get rid of this myth. Colon cancer hits everyone equally in this country. Hits everyone, black, white, purple, and green. Yes, blacks, and especially black males, have increased deaths as it relates to colon cancer. I'm going to tell you why shortly. But the main risk factors for for colon cancer are the environment, meaning just the air we breathe, the polluted air causes colon cancer. And you can do that by comparing us to non-industrialized countries. Won't go too much into that. And diet as well. Diet plays a unique role. Yes, vegans have a decreased risk, but not a significant decreased risk, but there is a decreased risk as well. Just a few facts. 1 in 20 people will get colon cancer. 1 in 20 people will get colon cancer. Unfortunately, 40% of Americans do not even get a colonoscopy. 40% of Americans do not even get a colonoscopy. And as I've talked about previously, that 90% of colon cancers are prevented. Let me just say why screening colonoscopy, again, is so important. It starts off, colon cancer starts off as a little pouching, as a little outpouch, as a little polyp, which is an outpouch of your colon. You have no symptoms. You don't even know anything's going on in stages 1 and 2. When they do a colonoscopy, they can go in and see that polyp. They can see it, and they can incise it and test it. Otherwise, that polyp goes up. If that polyp is cancerous, it grows for about 3 to 5 years, and the next thing you know, you're past stage 1 and past stage 2, which are the curable stages, and you're at stage 3 and 4. And then also, family history is important, but I need you to really listen to this point. 80% of colon cancers, it's the first time in that family line, meaning that 80% of the people who get colon cancer, there is no family history. There is no family history. If you do have a strong family history, yes, you are at increased risk. Now let's go to the Black males, and this is where the system failed them. And I'm part of the system because I'm an ER doctor. And let me clarify, I'm an ER doctor. I am not a GI doctor. I would encourage you all to visit Dr. Kester Cross. He's an internationally known gastroenterologist. But let me tell you how the system fails Black males, and probably why women don't fall into this. From the pediatrics all the way to the pediatric age, there are routine checkups that we need. After the age of 18, for males, there are really no routine checkups. Obviously, you should see your doctor. Whereas for women, there are the routine pap smears. So you're never disconnected. And then as it relates to the Black males, the system and the studies are very clear. The medical system at about 20 to 30, it kind of treats us differently. When we go see them, we don't see the same primary care doctor. And so therefore there's not that connection. The system kind of treats us like it doesn't want us. And so therefore we don't do the preventive care. Then later in life, when we need the preventive care, we haven't been. And then the system says, well, the Black males are not going. Well, hold on. You've not made us feel welcome. And by the way, this is not Dr. Geoffrey just talking. There's been numerous studies that talk about that. And what is my point? Regardless of how the system treats Blacks and Black males and disadvantaged populations, it's not about us. It's about our families. It's about our families and making sure we are around to protect our families. I would encourage all Black males and everybody, but I'm talking to the Black males, still go and get your colonoscopies. Still schedule it. And I get it. Sometimes the system does not treat us the same as everyone else. But this is a 90% curable disease that if caught early enough. So please make sure we get our screening colonoscopies. And ladies, sometimes, even though I just said that, us males are kind of hard-headed. I would tell you, ladies, please take your loved ones with you. Take everybody with you. Take your loved ones with you when you go get your test so you can get your screening colonoscopy. Hey, I'm Dr. Geoffrey. I'm a decisions expert and a disaster expert, crisis expert. Follow me on YouTube at Dr. Geoffrey. Follow me on my Facebook channel. But most importantly, let's be kind. I also dropped a link in there about if you get COVID, and there's a good chance that you very well may, please, it's going to be okay. But if you get COVID, follow that link. It gives you some extra additional advice about what to do at home. Be safe out there. Make sure you do something nice and kind for someone. This is Dr. Geoffrey. I will see you soon, and be safe. And take someone, doesn't matter whether they're Black, white, purple, or green, to go and get their screening colonoscopy. We're all in this together.